A brand new controversy is heating up over the widespread vitamin D deficiency a lot of you have been told you have by your own doctor. Some have called it a crisis. But were we given the best data on how much vitamin D we really need? Or has the whole thing been overblown? Take a look.
It's been called a vitamin D deficiency pandemic, with 3/4 of U.S. teens and adults showing low levels in blood tests. Over the past 10 years, health professionals have largely touted benefits of vitamin D to help with a whole host of health issues. The public and the medical community has responded. There's been an increase in testing. Sales of vitamin D supplements have soared, and more people have opted to leave their sunblock at home. So, what spurred this sudden spike in vitamin D deficiency? The New York Times says the answer may lie with one doctor, a Boston University endocrinologist who has worked tirelessly to increase vitamin D awareness in healthcare professionals and patients nationwide. Dr. Michael Hollick led the Endocrine Society to set new guidelines for vitamin D, putting optimal levels 10 units above other widely accepted standards. But now, Hollick faces harsh media criticism, with accusations that he was motivated by financial gains from the testing, tanning, and diet industry. No matter what his motivations are found to be, the greater question has been raised. Is it time to rethink vitamin D?
All right, you can see why this is a tough one. Vitamin D deficiency is associated with some important conditions like cancer and heart disease, diabetes, depression, cognitive decline, even poor bone health. Depression is one that really bothers me a lot, and it's so ubiquitous. Could it be linked to this hormone? Because that's what vitamin D is. And now this controversy has left a lot of folks confused. In fact, who in the audience feels like they're not quite sure what to do? We got a couple people here. Hi, what's your name?
Hi, Michelle.
Michelle. So how is this affecting you? Hearing both sides of the story bouncing back and forth.
Right, so I'm a mother of two, a 6 and an 8-year-old, and they recently got tested, and they said that their levels were low for vitamin D. So what do? Put them on vitamins to make it, see if that works. So next year goes by, same levels. So I'm confused. Do I give them the vitamins? Do I don't? What do I do?
Do we even check levels? That's part of the problem.
True.
Let's get into all this, because this is one of the things that I want to get to today. Sometimes you hit it on both sides, but today I've got two experts. We're going to take a deep dive, giving you the latest and best information. It's based on the hardest science, so you can decide for yourself. I invited Dr. David Katz, who's one of the founding members of the True Health Initiative. He says everyone should check their vitamin D levels and take a supplement if they're deficient. And Dr. Natalie Azar, who's on the other side of the conversation, she says we might not need to be as afraid of lower vitamin D levels as we currently are. So before we get to the debate, what has happened with vitamin D? Why has it touched such a nerve? Everyone I talk to is infatuated with the battle.
Yeah, well, so, Mehmet, as the setup so nicely described, a lot of information has gotten out there to suggest everyone's deficient, everyone needs more. I think what has people now really worried is that, was there a scandal? Was this all about money? And I think the public's looking for clarity on the topic. Good thing you're covering it.
Well, thank you. Here's the thing, science evolves continually. It's constantly changing. Coffee's a cure. Coffee's a killer. On this show, we talk about this a fair amount. And the purpose of the program is to dig through all the clutter that's out there and bring you the facts, the stuff you need to keep yourself and your family healthy. Mm-hmm. So vitamin D can work in a lot of ways, in natural forms, and it's a critical element to us. So vitamin D is a sort of complex structure, right? But it's a hormone, actually. It's a nutrient you can get from one of three sources. You can get it from the sun, which is probably the best source. You can get it from some foods. I'll come back to that later in the segment. And there's some supplements, of course, that are important sources for a lot of folks. Now, in your body, vitamin D works as a hormone to signal a lot of good things to happen, right? It manages the calcium in your blood, in your bones, and in all the other parts in your organs is when your gut, so that you actually have the right amount of calcium in all those different places. But it also makes all the cells of the body communicate better. So not surprisingly, it's sort of confusing to tell if it's perfectly designed for you. Do you have the right amount, not quite amount? Dr. Katz, what is the concern about a deficiency?
Well, if you're deficient in vitamin D, the primary adverse effect is on the skeleton. So you're not putting calcium into your bone because you're not absorbing calcium in your intestine in the first place. Absolutely critical role in calcium absorption. But the reason that we're worried so many people may be deficient is, as you said at the very beginning there, we're supposed to make it from sunlight. we live and work indoors, we cover up with clothes, and if ever we're outside and exposed, we've been told to wear sunscreen. We're not making it from sunlight these
Now,
days.
that's the argument that a lot of docs are making. But the converse, Dr. Azar, is we don't seem to be able to prove that it makes much of a difference.
Right. And I think one of the biggest issues now that we've had is that there's no good consensus on what a true deficiency is, the definition of a true deficiency. There's no agreement in the scientific
Our job
community.
today is to give our best advice.
Yeah.
And we've all reached out to colleagues and we have an idea. So you're saying theoretically it makes sense. You're saying in practice we can't show it. Dr. Katz, where does that leave us?
Well, I think it leaves us deciding what do we mean when we say deficiency. We have good reason to think that modern living is not producing optimal levels in the body and in the blood.
All right, so the big question is, who should be tested? Hey, come on over here, let's do this. Now, I know you guys did for here, so we're gonna put you in front of each monitor, and you can battle away. Dr. Azar, who's high risk and who ought to be tested?
So here are my red flags. I have postmenopausal women, I have older men, let's say over the age of 70, or anybody who's really at risk for osteoporosis, which encompasses a lot of people. It could be people on chronic steroids, people with chronic inflammatory or autoimmune diseases. I don't necessarily endorse population-wide screening.
All right, Dr. Katz, your list much more extensive, and it pretty much seems like everyone in the population is here.
Yeah, I think they are, Mehmet, because frankly, modern living puts us at risk for vitamin D deficiency, and frankly, there's clear indication that over time, levels at the population have dropped because we're indoors. We live in northern climes. We have winter where we don't get out much. We're dressed, we're covered, we wear sunscreen when we're out in the summer. So everybody who is not getting vitamin D from sunlight is at risk for deficiency if they don't get it from diet. And now more and more people are choosing alternatives to dairy, which is fortified with vitamin D. So if you're not getting it from concentrated sources in food and you're not getting it from the sun, the only place left to get it is supplements. And many people want to know, should I take a supplement? And so they want to be tested first. So you could argue testing routinely is not at all unreasonable.
All right, let me offer everyone my final thoughts. And there's a big debate now about this, in part because the testing is really expensive. It's costing us a fortune. And I actually think we are over-testing. Not because we don't need the vitamin D. Because even though studies have shown supplementing with your diet with more vitamin D isn't changing everything, lots of data shows that having adequate levels of vitamin D can be important to your health. So for me, it comes down to the risk and the reward. I like taking vitamin D as a supplement. I do it every day. I'm going to continue doing that and recommending it to my family. It doesn't hurt me. There's little or no downside. And I don't really think it makes a big difference if you check your levels before you start it, because it's a pretty safe thing to do. And so many of us are deficient. So up next, we have the grocery checklist you need to get the right amount of vitamin D every day. We are back with the vitamin D grocery checklist you can use to get the right amount of vitamin D every day. Some of my Bike Club members are here. Going to be helping me do the shopping today. So Donna, speak for the whole Bike Club. What is your interest in vitamin D in food?
Well, I think that it's a very important thing, and I know as a breast cancer survivor, I feel that taking care of yourself is very important. And having 3 kids at home, one who had a vitamin D deficiency 6 months ago, I think it's a very important thing for us all to be aware of.
Well, first of all, congratulations
Thank
for
you.
being a survivor.
Thank you.
And I hope your vitamin D levels of your child is back up again.
Yes, thank you very much.
All right, so surprise
Yes.
everybody, this is the first of our vitamin D grocery checklist items. It is cremini mushrooms.
Thank you.
Now, these mushrooms are representative of all mushrooms because guess what? It's the only produce that has vitamin D in big numbers. And this a serving of cremini mushrooms is twice the national recommended amount of vitamin D. So it's not a bad way of getting there. Do you cook mushrooms at all for the kids?
I do, a lot, actually. My mother-in-law has a wonderful recipe that she makes a good chicken marsala that we
chicken
make.
marsala?
Yes, my husband makes it a lot, and she does as well.
Puts it in the sauce, puts
Yes.
it on top. Oh, it's
Yes.
the best.
So that's how we get it a lot.
The
but-
texture goes with chicken nicely. You go
Yes.
back and forth, back and forth.
Yes.
It titillates the taste buds.
Yes, it's very good.
All right, good.
no, we
Enjoy.
do. Thank
And
you.
you know what? These are a gift from you from the
Oh,
show.
thank you so much.
Yes. Trouble. Annie,
Yes,
fish. Do you like fish in general?
I do.
Do you like canned fish?
I've never had canned fish. I am from the Gulf Coast, so we eat a lot of fresh fish. So,
You eat tuna fish? That comes out of a can usually. You don't eat that either?
No.
All right. Well, for those of you who are squeamish about fish, I know many of you eat tuna fish. I'm going to change your mind on something that I haven't talked about much. Are you ready?
I'm ready.
Grab that. I eat canned fish, but this is the kind of canned fish that I have. Smoked oysters. Now, hold your toes back now. I know you're all running to the stage here to have some of these things. But Canned oysters are fantastic. They are inexpensive, and I want America eating more of these things. They are so delectable, or they're so perfectly made for snacks. I don't know why I haven't been eating more of them. And you know, a lot of you can't afford to eat oysters when you go out in a restaurant because they're, you know, $25 for whatever it is for a dozen of them. But these are $5 for a dozen of them oftentimes, and they look like this. So are you willing to taste one of these with me?
I am. I'm a little nervous.
Okay.
Okay.
But this is a growth opportunity.
Okay. You
I'm
ready?
going to speak for all of America. Go ahead. Speaking for all of America. Let's see what you think. Your mouth is so full now you can go up or down if you want. You like it?
I did.
Oh my goodness. I like the chewiness. They've got a savoriness to them. You can make lots of dishes out of them. And people don't think about canned oysters, but they are smart and they have vitamin D in them to boot.
Very good. I need a glass of champagne.
Oh, now we're talking. There's a golf toast coming out. All right, next vitamin D grocery checklist item is something your mom probably told you about, cod liver oil. So Jay, have you ever had cod liver oil?
No.
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 Your mother didn't penalize you or punish you with cod liver oil?
No, my mom didn't make me do any of those terrible things.
All right, so it comes in a bottle. You can take pill versions as well. It's sold as a supplement. It's been used for centuries
Wow.
for joint pain. And there's a couple reasons that it probably works, but I gotta say the vitamin D is a big part of it.
Oh, okay.
So again, I don't think they taste, the cod liver oil tastes as good as those beautiful oysters we just were talking about with Jay.
Yeah.
But here, take this. I'm gonna toast to you, Jay.
Oh, it's my birthday, so
It's your birthday?
It is.
Give me some tequila. Get the tequila out here. All right.
All right.
Give it a taste, see what you think. And there's one more thing. For all of you all out there, one more item on your checklist. I knew you wouldn't like it. Here.
So we're gonna follow this with tequila, right?
Yeah, tequila comes out. Here, have one of these oysters. That'll keep you busy.
All right.
But the other thing for everybody is just park a little further away from the store. Sounds crazy, but actually, the sunlight as you walk in there and walking up the cod liver and the tequila and the oysters, it's good for you. That's the best way to get your vitamin D. All right. Good exercise as well. Thank you very much. Head over to DrOz.com for the full vitamin D grocery list.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.